Tanya Furr, as well as Dr. Dina Hinshaw, the Chief Medical Officer of Health for Alberta. Minister Furr will provide some brief updates, and then Dr. Hinshaw, and then we'll open the floor to questions.
So thank you all for tuning in today. As Premier Kenney has announced, we are relaunching our economy in stages, beginning with stage 1 later this week. Alberta's staged relaunch strategy puts safety first as we gradually reopen the province and get people back to work. This is a result of the hard work of Albertans and their adherence to public health guidelines. The safety of Albertans will inform all stages of our relaunch strategy. This strategy was developed with advice from public health officials as we carefully and gradually lift the restrictions on our economy and our lives. Together, Albertans' efforts to adhere to public health guidelines have helped reduce the spread of the virus to allow for a gradual reopening of businesses, services, and recreational opportunities. Today, I'm here to announce an additional resource to help businesses prepare for reopening. My department has launched our BizConnect website, which can be found at alberta.ca/BizConnect. That's biz with a Z. This new business-specific webpage will help businesses learn more about the public health measures they need to have in place before reopening. These measures will help keep their staff and customers safer while operating during a pandemic. My department, in coordination with Dr. Hinshaw and the Ministries of Health and Labour and Immigration, have developed information for businesses that are able to reopen in Phase 1. The website's sector-specific information gives businesses an easy-to-follow roadmap for reopening. Information will continually be updated to support the various sectors as they relaunch. Today, you will find information for the following sectors: hair salons and barbershops, daycares, day camps, restaurants, retail, museums and art galleries, outdoor shooting ranges, and more. This website will also provide businesses with a platform to ask questions. The BizConnect website also contains an up-to-date Common Asked Questions section. Here, businesses can see if other businesses have asked the same question, and if not, they can send in their questions to be answered. In collaboration with the Associate Minister of Red Tape Reduction, we have also added a red tape suggestion portal similar to Ontario's. This will allow businesses to provide us with suggestions to reduce burdensome red tape that prevents them from reopening safely or easily. Our new website will also link to BusinessLink, a government-funded organization that connects small businesses with free advice to access government programs in a one-on-one setting. Albertans are strong, and I know we will address the ongoing economic challenges with the same common sense, adaptability, and resilience Albertans have shown throughout this pandemic. Even during the hardest of times, Albertans have always stepped up to meet the challenge with innovation and an entrepreneurial spirit. By working together, I know we can ensure our sacrifices to slow the spread of COVID-19 continue to be successful. To be successful during the economic relaunch, businesses should continue acting responsibly, and I know they will rise to the occasion because it's in the best interest of their staff and customers. So as we relaunch, let's continue to stay safe.
Thank you, Minister, and good afternoon. For today's numbers, there are currently 73 people hospitalized with COVID-19, with 12 of those admitted to ICUs. In total, there are now 4,659 people who have recovered from the virus, leaving just 1,524 active cases in Alberta. In the last 24 hours, out of 2,864 new test results, there were 47 new cases. I'm sad to report 2 additional deaths, which occurred in continuing care facilities in North and Calgary zones. 2 previous deaths that were reported have since been ruled as unrelated to COVID-19. Therefore, the total number of COVID-related deaths in Alberta remains at 117. We are forced to grieve differently in this time of pandemic, physically distant from extended family and friends, and I offer my sympathy to all those navigating that difficult terrain right now. As of today, there are 102 active cases in outbreaks at continuing care facilities across the province. 542 residents of continuing care facilities have recovered. At the Cargill facility, there are now 36 active cases in workers and 911 workers who have recovered. Unfortunately, one death reported over the weekend was an employee from Cargill who fell ill last month. Although we are speaking about this today, the individual was hospitalized about a month ago. I offer my sympathy to the friends and family of this individual and all those who have lost their lives from COVID. There are also 58 active cases among workers at the JBS plant in Brooks. At this facility, 548 have now recovered. And at Harmony Beef, there are 16 active cases in workers and 22 individuals have recovered. One additional case has been identified at the Calgary Remand Centre, again through the facility's rigorous screening process when individuals are admitted. This case is not related to the case I reported last week, meaning there is still no evidence of transmission within the facility. I would also like to mention that we have 3 confirmed cases in workers at 2 unrelated Calgary daycares. The cases in question are isolated, and the daycares are currently closed as a precaution. All those who work in or attend the daycares are being offered testing, but at this time there is no evidence that the transmission happened in these settings. Public health officials continue to respond to each outbreak, contain the spread, and ensure all public health measures are enforced and being taken seriously. I also want to provide an update on the cases at a Canada Post location in Calgary that I was asked about last week. There are 6 cases that have been identified at workers in this facility. However, there were no connections between them, and their exposure seems to have been outside the workplace. A deep cleaning of the facility has occurred, and there is no evidence of transmission at the workplace, meaning there is no need to do testing of staff who do not have symptoms. It may seem odd to contemplate restarting the economy after hearing about these outbreaks. While the final decision on entering Stage 1 has not yet been made, today I want to talk about why we can consider relaunch at this time. First, the outbreaks I mentioned represent pockets of infection that we must deal with. However, much of the province has been successful at flattening the curve. Hospitalizations and ICU admissions are down, recovered case numbers are up, and I am encouraged to see fewer daily new cases than even 1 week ago. We continue to see cases of community transmission, and people have asked me how we can reopen our province when the virus is still spreading in our communities. We put our first restrictions in place after identifying 1 case of community transmission. That was in early March. I know it feels like a long time ago, and that is exactly the point. Much has changed in our society since then, and it will remain different for a long time still. Our societal norms around hygiene and physical distancing are different today. We are in the habit of washing our hands thoroughly and often. Whenever we unpack our groceries, handle goods delivered to our home, or come home from any location, we wash our hands for at least 20 seconds in warm, soapy water. We also maintain physical distance. We are well aware what 2 meters looks like and are accustomed to keeping this distance between one another. These will remain habits and, in fact, will become even more important as we leave our homes more often. We have put in place protective measures for those who are most vulnerable to severe outcomes by enhancing protections in continuing care facilities across the province to keep them safe from this virus. We have also enhanced our lab capacity and our ability to trace contacts and contain outbreaks. With this capacity, even though we will continue to see some cases of COVID-19 in our communities, we have the testing capacity and contact tracing ability to quickly identify new cases and prevent further spread much more promptly than we could at the start of this pandemic. With this expanded testing capacity, we also have the ability to do extra sampling in certain situations where we need more information about the spread of the virus. This week, we will be offering extra testing in Calgary as we are still seeing higher case numbers there than the rest of the province. While we don't know how much asymptomatic spread may contribute to transmission in a population, we know it is possible. Therefore, to get a broader snapshot of infections in Calgary, we will be making testing available for 1 week, starting today, to asymptomatic Calgary Zone residents who work outside the home. We can only test up to 1,000 people per day in order to make sure we leave room to test those who are sick. But I encourage anyone in the Calgary Zone who is interested to participate to go online and register for a test. Booking will be first come, first serve, up to a maximum of 1,000 asymptomatic people per day. It is important to remember that testing people who aren't sick just gives a point-in-time picture of whether they have the virus at a particular moment in time. It is possible, if someone has had an exposure, that they could test negative but go on to get sick later. However, offering testing to this group of people will give us more information about COVID-19 in Calgary at this point in time. Anyone who lives in the Calgary Zone, works outside the home, and isn't feeling sick but who wants to be tested needs to go to the AHS online assessment tool and register for testing this week. Please do not call 811 unless you are feeling sick. Use the online form instead. I want to remind people that our priority continues to be testing those with symptoms, including our new longer list that can be found online. Testing those who are sick is the most important way to track virus spread, and I encourage all Albertans who have any of the symptoms listed to use the online form or call 811 to arrange for a test. And I again encourage you to download the AV Trace Together app and use it wherever you are out to further improve our contact tracing ability. I know the idea of relaunching our economy evokes strong emotions in many of us. Some are eager to move forward and feel we are going too slowly. Others are worried we are moving too fast. There are as many opinions on this as there are Albertans, and it's okay to have different perspectives. I understand that yesterday, some were expressing their perspective at the Alberta Legislature grounds, and I want to emphasize that while public health orders are in place to protect Albertans, there is still room within to practice peaceful protest. Individuals who are respecting physical distancing guidelines are able to peacefully protest in outdoor public venues. I am listening to all perspectives and ultimately making my best recommendations for the overall health of Albertans. We will advance to relaunch cautiously, but we must proceed for our collective health and well-being. To make this work, we will need to do this together. It will take all of our efforts to continue to keep our infection rate low and prevent a surge in cases that would require us to restrict movement and businesses again. Those businesses that will be allowed to reopen in Stage 1 will be subject to strict guidance to prevent infection to staff and the public. As I have said, we are not going back to the way things were. We cannot go back. We must go forward. But we are moving forward in a manner that will allow us to continue taking steps towards some idea of normalcy in the future. Albertans have done a tremendous job following public health orders and guidance. Even when it was difficult, we have persevered. We have adapted. We have refrained from visiting loved ones and continuing care to keep them safe. We have held funerals with 15 people or fewer where we couldn't hug those with whom we were grieving. We have canceled vacations. Our kids have missed sleepovers with grandparents. We have all missed visits with our extended families and friends. We have had to get creative to connect with our loved ones. We have done all of this to get to a time where we can safely lift some of these restrictions. That time will soon be upon us. We must continue making certain sacrifices so that we can move forward together. I know we will succeed if we all commit to this goal. And while some restrictions will be lifted, we will maintain our new habits of connecting with each other even if we are apart, of staying home when sick, of supporting one another when we are struggling, and prioritizing the health of others and our province as a whole. There is no going back from that. Thank you, and I'm happy to take questions.
All right, we'll now go to the phone. In addition to Dr. Hinshaw and Minister Fur, we also have Mark Jaffe, Vice President and Medical Director with AHS. Operator, could you put through the first question, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. I just have a point of clarification and then a question. Just Dr. Hinshaw, I'm wondering the death over the weekend for the worker at Cargill, is that the third death related to this facility? And then I can jump right into my question here. Minister Furr, I'm just looking at the BizConnect website right now. We're 3 days away from the first major reopening date. So why did it take so long to make this information available to businesses across many sectors? And how can you be confident that all the businesses will have the time to properly implement these rules and follow their sector-specific rules? As well, I'm wondering how the province is supporting businesses with the financial burden of some of these rules. Like, for example, in the restaurants column, it says that masks need to be provided for staff that can't stand 2 meters away from the clients that they're serving.
So I'll take the first question. So this is the second death in a worker at the Cargill plant. And we have previously confirmed at least one other death in a close contact of a worker. However, given that it can sometimes be difficult to understand where people outside a particular workplace get infection, we're focusing at this point with respect to the severe outcomes from that outbreak on those who were workers. So again, this is the second death, tragic death in a worker at the Cargill facility.
So thank you for the question. With respect to why the website is up now, we wanted to make sure that we took the time to consult with stakeholders, businesses, industry associations, other provinces with respect to their best practices and what they were doing. We wanted to find the right balance between releasing the information on the website in a timely fashion, but making sure that the information on there was effective and useful. With respect to personal protective equipment, PPE, as part of the update to the website tomorrow, we will be providing a list of PPE providers for businesses to contact if need be. And also the guidelines for each of the sectors give advice around which sort of sectors are, what PPE we're recommending for each type of sector.
Operator, could you please put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, I believe this question may be for Dr. Hinshaw, but potentially also Dr. Joffe. You previously talked about the importance of contact tracing and preventing the spread of the virus. What is the goal and how quickly a confirmed case undergoes contact tracing? How often would you say Alberta is meeting that goal? And what does it need to be at for a safe reopening?
Sure. So with respect to the goal of how quickly we would want our team to be able to contact newly confirmed cases, ideally we would be contacting cases within 24 hours of receiving a positive lab result. I don't have the percentage of time that we're able to do that, so that's something we'll have to take away and get back to you. And I'm sorry, the final part of your question?
What do we need to be at for there to be a safe reopening of the province?
Sure. So with respect to the timelines, again, I think if we're able to contact the cases that we have within 24 hours, and if we can do that the majority of the time, so if we're able to contact people, I would say, more. We haven't set a specific target in terms of what percentage that we want to do that, but I think that what we need to know is that the contact tracing teams that we've established are working very hard to be able to contact people within 24 hours so that we can make sure they're aware of their positive result and that we can make sure that we're following up with their contacts as quickly as possible. So again, I'm not sure if Dr. Joffe has anything to add to that, but we will follow up and find out if we can determine how often we're able to meet that target of 24 hours. And I'm not sure there's a single cutoff at which point we would either succeed or fail. Again, I think the more promptly we're able to do that contact tracing, the better. And we have enhanced our contact tracing teams to be able to make that much more likely so that we have people across the province adding to our regular team of contact tracers.
Operator, could you put through the next question, please?
Next is Michael King with Global TV. Go ahead, Michael.
Hi there. For Dr. Hinshaw and whoever else wants to weigh in, again, looking at the Alberta Biz Connect under retail, there's nothing specifying shopping malls. And so how does that kind of fall into the reopening plan, and where should they find guidelines, and what sort of guidance is the province offering for shopping centres?
Sure. So maybe I can start, and then if there's anything that Minister Furr wants to add, she can chime in. So it's really important, and I've said this for most of last week, to know that we have very detailed guidance for all workplaces that's applicable in all settings. So that would apply to shopping malls, it would apply to retail businesses, it would apply to any of these specific sites or sectors that we now have some additional guidance for. And so a shopping mall can go to that document, again, that's the workplace guidance document, and they can work through that list and see how that can be applied in their setting. So a shopping mall is going to have potentially food retail in it, so fast food or food courts. And so they'll be looking at the parts of that particular guidance document that's relevant to food settings. There obviously is retail in those settings, and so there's parts of that guidance that apply to retail. And then there's the general spacing kinds of things, so making sure that there's reminders perhaps at the entrance for people to be thinking if they're feeling sick, they should not come in. Reminders for people to stay 2 meters distant from each other. So some of those kinds of things are in that general document that would apply again to any business. So, we can't necessarily know, at least from the health side, all of the details of what's required in a particular workplace setting, but we provide that guidance that's applicable across all settings, and then workplaces and sectors can work with that to adapt it to their own setting. And I'm not sure if Minister Furr, you have anything to add?
Thanks, Dr. Hinshaw. I'll just add to that the website does include a link to an email that businesses can email with any specific questions that may not be addressed on the website. Also, the website also has a common asked questions section, which will be updated daily. So if we find we're getting similar types of questions from businesses, businesses can look for that under the common asked questions section as well.
Operator, could you please put through the next question?
Next is Harrison 09s with the Eagle 100.9. Go ahead.
Hi, Dr. Hinshaw. A lot of Albertans are still adhering to a strict policy of maintaining their distance from anyone outside their household. And as such, they're missing a lot of their significant others dearly. I'm wondering if you have an idea of when it might be safe to get within hugging distance of asymptomatic family members, significant others, and friends who do live outside the household.
So the recommendation that I would have right now, I know that people want to see family and friends and want to be able to see them in a way that doesn't require that they stay a hockey stick's distance apart from them, that 2 meters. And what I would say is that there really are two things that people need to be keeping in mind as we move into this relaunch. The one is that limiting the number of people that you come into close contact with is the best way to limit the possibility of spread. And so we've talked about the concept of cohort families before, where a family can choose to cohort with another family so that there is one other family that people can be close to, the children can play together, and having that idea of that cohort to expand a little bit from a single household to 2 households, and that concept still stands. The second, so that would be with respect to choosing a small number of people who you would say it's with this small group of people that would be sort of my cohort. But ideally, though, that group is also choosing to just cohort with you, because it's not going to be effective if you have lots of interlocking and overlapping cohort groups, because you need to limit the number of people that you have a close physical distance with. And the second thing that is important in this relaunch is when you are close to someone else, and that could be in the context of a business setting where you need to be within 2 meters from someone to have a service, so let's say hairdressing, for example, there are certain things to do to reduce the chances that there could be infection spread in that context, which involves things like making sure that people who are sick aren't in that business, whether that's staff or whether that's patrons, making sure that there's regular hand washing, disinfecting of surfaces, and we'll be releasing later this week additional guidance on wearing masks in public to make sure that people who are wearing the mask are limiting the chances that they may be infectious to others. Having said that, it's really critical to remember that if you're feeling sick, you should stay home. Wearing a mask is not enough to protect others if you're feeling sick, so you should not be out and about in the public, even with a mask, if you're feeling sick, except for the purposes of getting health care that you need after calling ahead and making sure that you have that conversation.
All right, we've got time for 2 more questions. Operator, could you put the next one through, please?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Thanks for taking my question. This is for the minister. I'm just looking at some of these guidance documents, particularly for retail, and there seem to be a lot of, I guess, suggestions that might be a little bit vague for business owners, such as screening patrons and customers for COVID-19 symptoms. What exactly does that mean? And just to follow up, more importantly, how are these going to be enforced? What's the enforcement plan?
Yeah, so actually, with respect to specific questions around the guidelines, I'll actually let Dr. Hinshaw speak to that. So.
Sure. So as I mentioned before, the important thing for businesses to consider is what mechanisms can they put in place to make sure that patrons understand what is required of them. And so different businesses, it's going to look different in each context. So you'd ask specifically about retail. And I think the things that a retail environment can do to lessen the chance that someone who's sick would be in that store, things like posting signs to make sure that people remember if they're feeling ill, they should go home. They should not be in that retail environment. And if someone is actively ill, then it could be the retail store employee or the manager. If somebody is, coughing and sneezing on the goods, then that person may say, I'm sorry, you need to leave the store. You should go home. A reminder of that. I think this is an encouragement for all of us to remember to reinforce the social norms with each other, that if we're sick, we should not go out. It is not expected that in a retail store there be someone with a thermometer checking temperatures at the door. That is not the expectation. But the expectation is that retail stores would reinforce the social norms in whatever manner is appropriate within that setting. And again, that could include signage. It could include reinforcing when they do see someone who's there who's visibly ill. And of course, making sure that they have a mechanism for checking their employees every day. So as their employees are coming to work, making sure their employees are feeling well and not sick. And if they are sick, then having them go home and make sure that they're tested if that's appropriate.
Operator, could you put through our final question, please?
Final question is Sean Penner with Everything GP. Go ahead, Sean.
Yes, thank you. This question is for Dr. Hinshaw. Just a clarification on the fatalities in the North Zone. I noticed that in the High Prairie area, where an outbreak at a continuing care facility was deemed much earlier back in April, one of those fatalities has been removed, and then one has been added to the MD of Peace area, the Peace River area, where there has been no outbreak to our knowledge that has been declared. So I was just looking for a little bit of clarification around that.
Sure. So I can tell you that the outbreak in High Prairie, that's the JB Wood Continuing Care Center, has had 3 deaths associated with it. And one of those is one of the new deaths that we're confirming today. But I'm not sure, I don't actually have the details on those 2 deaths that were reclassified. I know in general sometimes that happens if someone is deemed to have died of other causes, so they may have had a positive test, but the cause of death was something else. And so it's possible that was the reason for the removal of one death in that other area, but I don't have the specific details.
We can look into it and follow up with you, Sean. Thank you all for tuning in. We will provide another update tomorrow afternoon.